After the client has been checked in through the front counter, the role of the veterinary technician or assistant begins. The first step is greeting the client and patient. Approach this duo with calmness and confidence. Oftentimes, speaking with the owner for a minute without looking at the dog gives the dog a moment to assess you without threat. Casually observe the dog for fearful behavior. A few signs of fear include cowering, trembling, yawning and panting, or urinating and defecating. To lessen their fear, avoid approaching or facing dogs head-on, making direct eye contact, leaning over them, or grabbing at them. Place the dog's ID collar around the neck. The ID collar identifies the patient by their first and last name. This collar should be snug enough as to not entrap a foot, but loose enough to place a hand between the collar and neck. Place the leash over the dog's head by forming a large loop and hanging the loop in front of the dog to allow the head to pass through, then tighten it smoothly. Become competent using one hand to do this. Walk the dog to the back on a short leash. Prevent them from pacing or pulling excessively, as these behaviors may heighten anxiety. Small dogs may be carried. Weigh the dog on the scale. You may keep the surface clean by spreading clean newspaper on top of the scale between each dog. Restrain the patient for the examination. It is preferable for all patients to be examined before being placed in the kennel area. The doctor will perform a basic physical exam, which will include observation of the mucous membranes, hydration status, auscultation of the heart, palpation for an abdominal hernia, verification of the sex, and general overall appearance and demeanor. The dog will likely be pre-medicated at this time. Place the patient in a kennel cage or run. Walk into the run in front of the dog if they don't immediately go in, as this dog does. Remove the leash, then step out while blocking the door with your body. If placing the dog in a cage, block the opening with your body so they are not able to jump out while controlling the door. Attach the cage card to the cage for identification purposes. This cage card should indicate name, origin, and whether or not they have been examined by a doctor or pre-medicated. Address hypothermia by adding a towel and/or a rice bag, and watch kennel areas closely for prompt cleanup of vomit, urine, and feces. Also watch your patients to ensure they are responding appropriately to pre-anesthetic medications.